Go ahead and call the meeting to order. Roll call. Cindy,
Here.
Marlene,
Here.
Heather,
Here.
Kim,
Here.
and is Joe on yet?
Jim's here.
Jim, was that Jim that I heard? Thought I heard Jim.
Yes, I'm
Okay.
here.
Okay, thanks, Jim.
And Joe is working on connection, but he is hearing us.
Okay, thank you. Approval of the agenda?
This is Cindy. I move we approve the agenda.
All in favor?
Aye. Aye.
Approval of board minutes for September 19th, 2024 board meeting?
I approve. I move that we approve the board minutes.
And I'll second.
All in favor?
Aye.
Aye.
Visitors' comments?
No visitor comments.
Board member comments? Yes, Marlene?
I've been trying to listen to the radio announcements to hear the timing of these wonderful workshops that are about to happen, and I keep not catching it right. So I think if Brandy sometime during the meeting can discuss what she's going to be doing, the presentations, and whether it's a four-part thing or whether you're presenting something, the same thing four times. I'm very excited that this information for long-term care financial planning is going to be presented to the public, and I think it's really valuable.
Jared, do you want Brandy to comment on that?
Yeah, go ahead. Now, since how it's brought up, now be a good time.
Yep.
Yes.
Yeah.
So yeah, we are doing a four-part, it's not parts, it's actually just one presentation, but I'm offering it 4 times. So it's next Tuesday from 6 to 7:30, the following Saturday from 3 to 4:30. Then the following week, it's on a Thursday from 6 to 7:30, and then that Saturday as well from 3 to 4:30. And so what that is it's just going to be kind of a beginning discussion of the importance of beginning to plan for long-term care needs, not necessarily long-term care, but what that means for your future and for your loved one's future as we age in our community. So, and these are strategies that can help people begin to look at their finances and look at their estate and start planning for if in that event that they need that kind of care. And so we're trying to mitigate all this crisis planning that's currently happening in our community, where family and elders are just at a breaking point. Not only are they dealing with chronic medical issues, but then they are now trying to deal with these higher level of care needs that they didn't plan for. And we're trying to stress is by beginning these conversations and normalizing this topic, we can help make that transition and that planning just easier. And there are far more strategies when we pre-plan than when we try to crisis plan. And planning for long-term care needs does not mean that you have to be, indigent, that you can't pass on what you worked hard for to your children or your siblings or whomever you choose to pass those on to, charities, whatever that looks like. So that's what this is going to be. And then my plan is to offer it again at least 3 or 4 times, starting like in February, just so we can kind of continue it and it doesn't just one and done.
Thank you. Committee reports, resource.
As noted at the Resource Committee meeting, I was scribbling notes like mad, but I just want to make a few points because I know that the information will get covered later in the meeting. Our investments continue to grow. Our financials continue to be strong. We had a long discussion about accounts receivable, and our accounts receivable days continue to climb. It's something that we will continue to be working on. We have a demand for long-term care, but we don't have space for more individuals. Clinic visits are up, radiology visits up, rehab's down, but we are looking for some staff, and some are not here all the time. We're still spending grant funds, and construction is on track. And I wanted to pass along that at our meeting, there was an expression of thanks for Sarah Wright, who is tracking a number of grants right now, which is very helpful. I believe 12 grants is what you said, I think are outstanding at this point. And we're waiting to hear on a USDA grant. It's still unknown. They have not awarded the grant yet, so we're waiting on that one.
Thank you, Cindy. CAH. Did Joe, that's Joe's, right?
Yeah, this is Joe. Can you hear me?
Yes.
Okay. Yeah, I was traveling in September for the Critical Access Hospital Committee meeting and I wasn't able to attend.
Okay, thank you. LTC.
I was also traveling this past week when that meeting happened.
Infection control.
The infection control, this is Joe. The infection control meeting was the most recent meeting was canceled. And,
Okay, thank you.
the next infection control meeting, I believe, is in December.
Okay, thank you. Kinderstog Advisory.
I attended that meeting, and we talked a little bit about, at that time, Kinderskog was applying for getting additional certifications for Orca camps and Kinderskog. I'm happy to report that both of those came through from the American Camp Association. Katie sent me the certificates today, and so that was exciting to hear. We talked about the interest in and the number of kids who attended Orcapods. And at that time, we were anticipating the visit of our AmeriCorps worker who is now on staff. I commented that I had seen the kids with the instructor at Sandy Beach. It was kind of fun to watch everybody being really excited and getting lined out. I also heard from the attendees of the kayak session that everyone had a really wonderful time. And all the reports from that have been really outstanding. And then the instructor from that, Katie has reported, would like to come back to Petersburg and do that again. And that's about all I've got on that.
Thank you, Cindy. We'll go into reports. Case management, swing bed management. Any questions regarding that report of Elizabeth Hart's?
Did I read it right that there's actually four people in swing beds?
It's been the highest, you'll see on the graph, it's been the highest number of swing beds days in a long time. Yep.
Any other questions or comments regarding that report? Thank you, Elizabeth. Chief of Staff, written report. Any questions regarding Dr. Hulebeck's report?
This is Joe. I have a quick question.
Yes.
I was wondering, is there another dermatological clinic scheduled? Looks like he was here in August. I just wondered if another one has been scheduled.
I don't know that we have actual dates, do we? I had heard maybe May was the next target date that he was feeling like he was going to be available to come.
And that was Dr. Hess, yeah.
Okay, thank you.
Yeah, I'm pretending to be Dr. Hulebeck today.
Okay. Any other questions regarding that report? Thank you, Alice, for that report. Clinic. Any questions regarding that report? Kelly?
How did the flu shot clinics go? Was there a good turnout?
This is Angela Brignoli. I'm also pretending to be Kelly's wife out. They went pretty well. We gave about over 100 vaccines and half of them were high dose flu shots. So it was successful.
I did have a comment. I wanted to just clarify, if I'm reading the numbers right, we've had over 1,500 referrals so far this year. And if I did my math correct, that runs somewhere between 4 and 6 a day.
Not all of that is outside of the hospital. That includes, say, a referral to physical therapy or occupational therapy or that type of thing. But yeah, our referrals coordinator has been very busy right there.
Right, that's what it looked like. It looked like the number jumped out at me. Seeing that many referrals is a lot.
And they're going out in a very timely manner. When I first started working in the clinic, there was sometimes a long lead time to get a referral out the door, sometimes even a month. And now they're going out same day, next day. It's been incredible, the efficiency that has helped, get things moving.
Someone who's been referred recently, not like.
Thank you. Any other questions or comments regarding that report? I do appreciate the numbers. I mean, it's the graphs and the charts. I appreciated being able to look at those and just look at the numbers. I don't believe I've seen that in a while. So thank you. Kelly. Community wellness. Any comments or questions regarding Julie's report?
If you'd like a little bit more information about the accreditation that happened today, Katie's also here to answer any questions about what that means.
Well, by all means, yes.
Yes, the American Camps accreditation. I'm going to let Katie Homeland speak to that.
Yeah, we received American Camps Association accreditation for each the Kinderskog program and the Orca Camp programs. So they're accredited separately, which was kind of a strategic move, thinking long-term. And ACA, the American Camps Association, is a nationally recognized body that oversees programs such as ours. And they focus on safety, wellness, enrichment, and making sure that we have quality risk management policies and practices in place. There's a really extensive process. I mean, Julie saw how many. I joke about my binders and spreadsheets. There's a lot of them. And then it included a site visit from 2 ACA visitors this summer. And everything went really well. They were really impressed with our programs. And yeah, I was thrilled to get that email today.
Can I make a quick comment, if you don't mind? This is Phil. I want to thank you for the wellness program for putting on the helmets program. Can you talk a little bit about that? It's a little bit near and dear to me as an avid bike rider. I see a lot of electric scooters and electric bikes out there and no one wearing helmets, and I'm very, very concerned about injuries, especially as approaching the winter season.
Yeah, the Helmets Are Sweet initiative is a project that came out of the SHARE Coalition. I presented it to them in the spring, and it was very enthusiastically met. Regained some momentum this fall after my summer busy season kind of winded down. And we received funding from the State of Alaska Injury Prevention Unit, the American Legion, and the Petersburg Volunteer Fire Association to purchase all MIPS-rated helmets, which is like a rotational protection for helmets. So it gives you an extra layer of safety if you have an impact. And at Roll and Stroll School Day, we gave out about 25 helmets to kids in need. And I just purchased 55 more helmets, including helmets for ATVs and e-bikes. And then the rest of the helmets are multi-sport helmets that will be available to adults or youth in our community that need one. And we opted for all multi-sport this round because they can use it for biking, inline skating, sledding, ice skating. So trying to make sure that people are protecting their head even on a sled this winter. And yeah, hopefully we'll see a lot more people wearing their helmets and staying out of our ERs.
Thank you. Any other questions or comments regarding that report by Julie?
The only question that I had was on the Taiji Kwan. Can interested participants just drop in the middle of the schedule, or do they have to start from the beginning?
So the
And-
Taiji Kwan Moving for Better Balance program, it is recommended to start within the first 2 weeks, especially if you've never done anything like that. So we are a little ways past that. So the next round is more like starting in, I believe, January. That being said, if you've done Tai Chi or something related, it might be something you could pick up quickly, but there is a series of moves that build on each other. So it's kind of recommended to start in the beginning for best practice. But the bingo size program is more of a drop-in, come anytime, come once, come, at the very end or the beginning, doesn't matter.
Great, thank you.
Thanks, Cindy.
Thank you for that report, Julie. Dietary. Any questions regarding Jeanette's report? None. Thank you, Jeanette. Home health. Comments or questions regarding Laura's report?
Can I make a comment? This is Phil again. I just want to, I don't know if people have read the paper or on Laura's visit back to helping and assist with the hurricane in North Carolina, but it's a really good article. I encourage reading it. So just a comment about what Laura did, helping back east. So.
Thank you, Laura, for that report. New facility. Any questions regarding the Arcadis report? My understanding they're on track. The building's changed colors a couple times now,
Yes.
and that the windows are in. Is that my understanding?
Yeah, this is Phil. Justin's out hunting this week, so he had a great report. But basically, I believe the last window went in at the site tour on Friday. We had there was one window left, I believe, and I believe that's all hemmed in, and then they can work on the interior for the wintertime. Yeah, and it's on track, on budget.
Thank you. Yes.
I just had one comment, because Phil discussed the funding and the comments from Senator Stedman's office today. We have been communicating with them over time, and I shared with Phil some notes that we had in the past where the senator's office actually directed us to phase the project. We are taking that approach. So I just want folks to know we're not doing anything out of the ordinary. We are actually doing what the senator advised, and we will continue to follow along in that regard.
Advocacy is going to be really important to get to this next phase of the project and encourage community members to, speak out.
Thank you for that report. Arcadia, quality and infection. Questions regarding the quality infection report?
Yes, this is Joe. Can you hear me?
Yes, Joe.
Yeah. I just had a question about under the facility heading. In the second paragraph, it talks about the annual review and update a long-term care facility assessment. It has begun. The staff is working to incorporate new regulatory requirements. It says at the end of that paragraph that board member input is required in this process. I was just wondering is that input, board member input come on the long-term care committee? Or is that input going to be gathered another way? I don't know if Stephanie's there, but that's a question. I had.
Yeah, this is Phil. I can answer the question. Yeah, the assessment is a little bit of a longer process. Traditionally, it's gone through email. They've had different requirements. And what we did is at the beginning, since typically that's attended by a board member, and that's the way we're going to process it or handle it at the next quality meeting as well.
Oh, okay.
This is Marlene. I'm on the long-term care committee, and been in contact with them about when I'm going to participate in the assessment.
Okay, thank you.
Any other questions regarding this report? On the quality report by Stephanie. Stephanie? Infection prevention by Jennifer. Any questions on that report? None. Thank you, Jennifer. Executive summary.
This is Phil. Any questions on my report? I have just a couple of updates like I normally do. First is I just want to thank attendance from the board yesterday for the manager retreat. Cindy and Jared were there. It was successful and encouraging. I was pretty drained at the end of the day, but it was good input. Certainly great recommendations coming out of that day that we get to spend some time together. To build off of some of the other reports, just another congratulation on the ACA accreditation. It's a heavy lift. I mean, the certification, it's like, oh yeah, that's great, but there, how many binders? There's like 3 binders worth of policies and procedures, and it's quite a lengthy process. So really commend the group on putting that together. Let's see. It's been the graph related to inpatient days. If you scroll down, let's see, it's listed under the financial wellness one. It says inpatient days. You could see on the left-hand side, it says 162 days in the last month, which is, September. It's been at 160 plus for the last 1, 2, 3, 4 months now, almost. So that's really high. That's where that inpatient stays. The swing bed program, again, is just a designation of a Medicare program related to rehabilitation in our inpatient unit, and that's been pretty significant. ER visits are up and down. That's pretty standard. When you see the summer months, it kind of peaks and valleys when you see the volumes there. And then the encounters for the clinic, the primary care, which encompasses more than just a clinic, but you could see this general trend the last couple of years where we're increasing in number of visits. And that's really sort of the takeaway there, is we're increasing volumes and getting access to care. That's really about access to care. New facility, as mentioned also, is, we were continuing the weekly site visits, but we're going to sort of, what I realized when we went to the site visit for the new facility sign up, it's hit or miss. I think it's a little bit too much for weeklies, and also the darkness was a factor. When we went through, it was dark, and I don't want to have anyone trip and fall in the new facility there or outside the premises where it's still sort of an active construction site. So I think we're going to change the hours and probably move it to one time a month. We've had 2 or 3 weeks in a row where there's no one signing up for it. So, we did have a good presence this last Friday, but I think it's okay to kind of downgrade that a little bit coming into winter as that continues. So, and I also want to probably move the hours to more daylight, maybe a lunch hour. So more to come on that. Julie's going to help me get some notifications out for that. See, from everything else was covered. The access information graph, I kind of took that from the clinic, and that really talks about, the availability of providers and the next available appointment. And then the metric is usually a third next available appointment. That kind of gives you an indicator of the stability and how, a primary care visit, how far out you can go. So we're looking at that. It's, you definitely see improvement over time. We have a full medical staff now and really working hard at optimizing the schedule, and the clinic's just done an incredible job working on that. And as you heard, I think the thing that goes unnoticed is referrals. I was so glad to pull that out, and I'm glad someone commented on that, because it's astounding how many referrals are processed. And in the past, Dr. Hess is correct. That was a big issue. It was really hard to get referrals processed and out the door, and that improvement has been amazing in the last year, last 2 years. I know that's been a focused effort on that, and it's amazing how much volume comes out of that. So it's really, really great to hear. Grant-wise, we're waiting on maybe two grants still. I think the appropriations, we're still counting as a grant, even though it was designated, kind of moved forward. We just have to wait for Congress to approve that. And as far as I know, we're still in the queue there. And the USDA grant is the other grant that it's a federal grant. So the federal grant cycle starts October 1st. I would have been sure that we would have heard from them at this point, but it's still pending. I assume that we'll hear within definitely by the next board meeting, whether we receive that grant or not. And that's to help with some equipment and technology for the new facility, so that we can apply that there. And finances, Jason's on, is going to go over that. So, but a lot of the same efforts. There's been some really successful on the AR. We noticed, we've been noting that for a while now. That's an area of that we need to improve on, and we've trying to bring that in-house. And happy to hear the team has hired in that realm to start moving in that direction. So that's great. That's all I had for updates. Any questions? I'm probably missing a couple of things, but my brain's a little fried from the meeting, from the retreat yesterday.
I do have a question, Phil. On your graphs, there is the one that shows the 1,305 encounters in September and the 1,147 for the monthly average for the last 23 months. Are those clinic visits, or is that?
It comes from a primary care visit. It's the way it comes out of Cerner. And I think if Matt's and Jill in the room, they could probably add on more of that. But it's the encounter, and correct me if I'm wrong, I'm looking to the team over there, but it's the encounter related to that visit. And that could be lab, and that could be imaging as part of that encounter. I don't believe it counts therapies, but I'm not 100% on that one.
Therapies actually go on a
So it would be fair to say that somewhere in the PMC circle, these numbers are coming from. And so
It's mostly, it's mostly stemming from primary care in the visits lineup. It's inflated because it covers like nurse visits as well. And it also covers like if it's generated over to if you go into a primary care and then you're sent over to lab, or if you're sent over to imaging, it'll be bundled in there as well. There's also lab only. So it's like Joe was saying, sometimes it's a little hard to tease out those things, but they come from a primary care. It's an indicator for the clinic.
I just think it's important for people to know just how many people are going through the facility each month.
Yeah. I mean, the encounter and and actually in Jason's report on the financials, there's a lot more. There's definitely a better breakout as far as the numbers and volumes on that side.
And then on the last page, you have data sheet there that indicates the breakdown in providers and some of the days that if I'm reading it right, you may have to wait 24 days to get in to see some providers, or am I reading that incorrectly?
No, it's a metric called third next available. It's a primary care metric. So you can get, oh, Dr. Hess is here. She can actually report out. You can get a same day visit. So you can come in and you can get a same day visit. And that's available. The next available appointment, so the next available for somebody is in the second column. And then you can see the third next available. That's just typically used, and it's kind of gives you a better window of a standard. It's more of a standard on how available is, how busy and how available is a primary care provider. And I believe it's some sort of national standard should be right around 12 days, something, within the time frame there. So we want to improve that. But, you can see the providers who've been here a while have an established and panel man are going to be a lot busier, of course, than a newer provider. So is that correct, Dr. Hess?
Correct, yeah, and you'll sometimes see that number be like, wow, that looks like an outlier. Why does that person have to wait? Why do you have to wait so long to see that person? Sometimes for that month, that just reflects that that person took a 2-week vacation. And so then you couldn't get in for a while after that. But yeah, definitely, those of us that have been there longer, you're gonna see those wait times go up a little bit, but there's always those same day acute appointments. You might not always see the person that you really wanted to see, but we're saving those for every day.
And the better way to, the way I look at this more is on the average. So the last column there, you can
Right.
see that it's 3 days on the average, 10 days next available, 14 for the third next available. That's the way I would look at it as a department.
Thank you, because when I first looked at it, I was looking at those 24 that was jumping out at me, and I'm going, that's a long, long time. So I'm
Yeah.
glad you could explain it down.
Yep, yeah, and there's 6 so maybe I'll just stick with the average clinic amounts.
Any other questions for Phil? Phil? Financials.
Hello, everybody. How are you doing tonight? Let me pull up the financial statements really quick. Hopefully you can all hear me.
Yes.
Excellent. I'd like to start off with looking at the statistical report. It sounds like, we've covered it in different ways tonight, but we'll do it in the way we typically look at it from finance. I'm just going to look at the year-to-date numbers throughout the presentation tonight, keeping in mind that covers July, August, and September. These tend to be busy months for us, in particular May, June, which fall into the previous fiscal year, but July, August, September. You notice in general, that July is our busiest, and it gets a little, our volumes might go down in some areas in August and then a little bit more in September as the summer folks, those volumes of visitors to the community decrease. And so it is expected here at the end of the first quarter, we typically see this every year, that we are doing very well financially. And in fact, we are even slightly above prior years. And so as we look at the clinic visits year to date, we did 2,598. No, it says here year to date, but that's actually for the prior year. We did 2,344. So we're up 10% in terms of our clinic visits for the same time compared to last year. Radiology procedures are up as well. Lab procedures are up. Rehabilitation services are down just a little bit. We did have a small transition period as one traveler left and another traveler came. Home health visits are up compared to the prior year. Emergency department visits are down just a little bit, about 10%, or not quite 30 visits. Patient days doing reasonably strong. This time, the same time period a year ago, we did 90. For acute patient days, we have 110, where we are extremely busy and seeing a lot of patients, as has been indicated, as the swing bed unit. 370 visits or patient days, excuse me, as compared to 103. I need to clarify a little bit there. Certainly we feel very good about the opportunity to serve members of the community. And as we look at those numbers, to see the success of the organization. But just a reminder, as a critical access hospital, we are reimbursed on costs more so than we are based upon the number of patients that we care for. And so we see it's helpful for cash flow. Certainly, we're seeing money come in the door from providing these services, but as we go through the year, and then a year from now, we file the cost report, usually the numbers balance out. Usually we'll have a period of time over the course of the winter will be a little light. But probably getting started off so well, we'll probably have a strong year. But there may be a request for repayment back to Medicare because we've had so many patient days. That will most likely be offset by some of the things I'll talk about in the statement, but just wanted to remind the board that we take great pleasure and honor in serving the community, and glad to see that if people have needs, that we're able to stand up and take care of those needs. But we often have to ask whether that translates into stronger financial performance or not. Long-term care days, doing well there, 1,200 resident days as compared to the same time prior year, 1,233. Okay. Just going to touch a few highlights here with regards to the income statement. So gross patient revenues, we break this out by some major categories. As you can see, we're inpatient unit, including our swing bed services, are $1 million above what they were the same time a year ago. This is due to the increased patient volumes. As indicated, we will reserve some funds, potential for repayment back to Medicare. That will be offset by outpatient. As we can see, our ED visits were down a little bit. And so we'll most likely have a Medicare may actually owe us money with regards to the outpatient. So those may balance out a little bit. Long-term care, there's no repayment. We rebase that every 4 years. We had a rebasing period last year. And so it's good to see strong patient volumes in the long-term care. Based upon costs, so we're glad to see strong volumes there for and home health services. So year to date for the 3 months, we're about $1 million budget. Deductions are as per normal. And so our total operating revenues, we're seeing that that we are about $1,200,000 above budget in total operating revenues. Expenses, we're also running a little bit above budget. The largest area is contract labor, having to bring some individuals in to cover some different areas. Supplies is also running above budget. I suspect this has probably more to do with our medications, in particular our IV solutions. You may be aware that there was a plant that was in North Carolina that was affected by Hurricane Helene, I think is the name. And that facility has been down for a good month, 6 weeks, maybe longer, and is impacting. And there's only 2 or 3 actual production plants in the whole country, which is quite amazing, providing IV solutions for the entire country and probably even some other countries. But with it being down, shut down due to the hurricane and some damage that was performed there, all hospitals are on rations with regards to IV solutions. Fortunately, we do stock up given our remote location and are able to deal with that well. But as we purchase additional ones, it's probably impacting our costs for supplies. Operating income. So we, year to date, $745,000, as indicated. We may have to refund some monies to Medicare. We'll see how over the next quarter if our patient volumes decline and we balance back out, compared to prior years. And of course, we have a very strong capital grants that we're receiving for the construction of the organization. So the bottom line, when you add capital grants and things of that nature to our operating income line, $4,879,000. That's doing well. As we indicated, due to these increased patient volumes, we're receiving greater cash. accounts payable, we're all caught up on things there. No concerns. We've talked a little bit about some success in hiring a person, looking forward to hiring 2 or 3 more, insourcing the business office. Look forward to having that complete and in place by the end of first quarter for 2025. We would, it's going to take winter to get get them in place, and then finalize the transition without disruption, and then just continue services with the current service provider. So, okay, I'll stop sharing there. And just a couple other updates. We are very close on standing up the 340B program, pharmacy rebate program. We've signed agreements for everything. Just one more. I've got to work with Phil tomorrow to sign with regards to a client compliance or audit firm who will examine the transactions once a quarter. But we have things in place with Rexall. We have things in place with the third-party administrator. We're completing applications. We're coordinating the connectivity with computer systems, be able to receive the information to complete those transactions. So looking forward to having that in place. That will benefit community, will benefit Rexall, and also benefit the hospital. And the audit has gone very well. It's the field work, I think, for the most part is done. There is still some conversation back and forth with regards to some variance analysis, and we are working hard on getting the information over to our cost report consultant. So a busy time for the finance department, but all is going well, and we appreciate the support of everyone who, we claim as being a part of the finance department. That's everybody in IT and the business office and accounting and that, and even grants folks, everybody working hard together and being able to come up with resources, complete our audits, things of that nature. We had a good conversation yesterday, and with regards to the leadership retreat, and I just wanted to kind of highlight, what we talked about from a finance perspective. And so we understand the strategy, from a physical perspective, is to be shovel ready, to have a campus and everything in place, that when that grant opportunity comes along, that we are first in line to receive those resources. The finance department and the organization, we talked about being grant ready, that when folks look at us, they can see that we are a sustainable organization, that if they grant the funds and we build this building and there's the additional costs to operate that building, will we be able to sustain that? And the answer is yes. There's one thing that we need to do, and that's insourcing the business office and getting our days in AR down to industry standards and our days cash on hand up to industry standards. But that will make us credit. We currently are grant eligible. Obviously, we receive grants, but that's the only area. We did an excellent presentation comparing our financial key performance indicators to national standards, national averages, or that are monitored by Medicare and the Critical Access Hospital Flex Monitoring Program. And we compare very well across the board. Profitability indicators, liquidity indicators, capital indicators, things of that nature. We're managing our resources very well. The only opportunity we saw is to improve our days in AR and days cash on hand. So any questions from the board?
Yeah, this is Jim.
Go ahead, Jim.
I have a question on the statement of revenue. Revenues and expenses. The last column of variances at the bottom, all the numbers seem to be way out, the percentages.
So you're looking at the income statement of revenues,
Right.
and expenses, and you're looking at which column?
The last column, it's the variance column, the last one.
On the very far right?
Yes.
Okay. And so that would be a variance. Those numbers are in comparison, the current actual as compared to the prior year to date.
Right.
We'll double check those and see if those are calculating correctly.
Yeah. Yeah, because the income from operations is 22,000%. Couple lines up. All those and other ones, a lot of them are minuses that look like they should be positives. So.
Very good catch. We'll take a look and see what's going on with our formulas there and get that corrected.
Okay.
And if needs be, resend that out.
Yeah.
Sometimes we get a little too focused on, you know, the, just getting what is the financial performance and the actual look like? We don't glance around at the whole page, but thank you for noticing that, and we'll get it corrected.
Yeah, the other variance column looks good.
Any other questions?
for Jason? Thank you for that report. New business, review of hospital board committee appointments. Current board appointments are as follows: Quality Improvement Committees, Long-Term Care, Marlene Cushing; Infection Control, Joe Stratman; CAH, Joe Stratman; Resource Committee, Jared Cook; Cindy Lakadakis, Heather Kahn. Joint Conference Committee is the board president. Foundation Committee, Heather Kahn. Community Engagement, Jared Cook, Marlene Cushing. Evaluation Committee, Jared Cook, Marlene Cushing, Kim Simbahan. Bylaws Committee, Jared Cook, Joe Stratman, Cindy Lakadakis. Kinderskog Advisory Committee, Cindy Lakadakis. What I would like to do is, because we have a new member that just came on board, I didn't want to try to shove committee stuff on everyone right now. I wanted to give them a month to think about it. So right after we have, Sheena, for the elections or for the agenda next month, we would have to have officer elections. And it would make sense to have that prior to committee appointments.
Understood.
So this gives you board members a month to mull over what committees they would like to be on, and we'll decisions at the next. Next hospital board meeting date. First, correct? Or the, 21st?
We get back on the 20th?
It's Thanksgiving that week. Is that week or is that the following week? Okay. Great.
First probably looks like the best option there.
Mhm.
How does that look for you guys?
Yeah, this is Jared. This is Joe.
Yeah, go ahead, Joe.
Yeah, the Board of Fish meeting is coming up January of 2025, and there's a lot of advisory committee meetings I have to attend this month. Fortunately, I don't have the schedule of all of them in front of me, and I get new announcements kind of by the day. So I think that date will work, but I'll let you know if I have a conflict.
What was the day you said, Jared?
21st of November.
Okay. I get back to 22nd, so.
The only thing we have done in the past is because of Thanksgiving, we have moved it to the first week of December. I'm not sure if that's an option we want to do or not, but if we could do it on the 21st, I would prefer to do that.
Okay.
Okay, do I have a motion? Yes.
Do you mind if I add one thing since we're talking about dates? And I forgot one of the things I forgot from executive report was the work session for the assembly and the board work session. I talked with Bob a little bit and he was looking at somewhere maybe the third week of January. I mean, it's tentative, but just to get your mind wrapped around that, it's a good enough lead time. It's kind of around the same time that we did it last year, and just want to run it by the board.
That would work for me.
I will not be available until after the 13th of January.
Else on dates? Do I have a motion to go into executive session? The motion would be to enter into executive session to consider medical staff appointments and reappointments.
I so move.
All in favor?
Aye.
Second.
Thank you, Cindy.